The first thing that happens is that the television and the radio start talking to me personally, and they always tell me the same thing, that there is an imminent neo-Nazi Holocaust that is about to happen in Britain. My name is Laurel and I have paranoid schizophrenia. I've had this diagnosis for the past 20 years. My last encounter with the police happened about 2.5 years ago. I'd been ill for a couple of weeks and I was in my apartment and I was making a handbag. What happened was I heard my downstairs neighbour's front door being kicked in. And because at the time I was hallucinating, I thought that they were in imminent danger. They were a very young couple with a 3-month-old baby. And without really thinking about it, I picked up my tailoring scissors and went outside to defend them. I was seen in the communal hallway by another neighbour who dialed 999, and 8 police officers in stab vests arrived, plus the armed response vehicle. I was arrested in the hallway. I was searched in the back of a police van. I was taken down to the local police station. I was put in a cell and kept there for 18 hours. During my time in detention, my psychosis became really quite unbearable. I became very, very paranoid, and I was absolutely convinced that I was going to be murdered by the police. The police didn't ask me about my mental health background. As I said, I hadn't seen a mental health practitioner. I actually didn't have any access to medication until about 3 or 4 days later, when I finally saw a psychiatrist in Eastwood Park Prison. I feel that I shouldn't have been incarcerated in a police cell. I should have been in a proper place of safety where my mental health wasn't going to deteriorate considerably as a result of the detention. I have huge gaps in my memory of my court appearance. The next thing I was conscious of, really, was being in Eastwood Park Prison, where I was remanded for 3 weeks.
If somebody is encountered by the police in the community, in a public place, and they have mental health issues, they have vulnerabilities, they're perhaps behaving in a way that's not understood, police are in a very tricky position because they have no information to access to inform them what might be going on for that person. So they have to make a quick decision as to what to do with that person.
Essentially, the police have 2 options before street triage. If they detain someone under Section 136 of the Mental Health Act, they would need to take them to a place of safety. Now, currently there are 2 types of place of safety, and that would be a health-based place of safety or a police police place of safety, which essentially means a police custody.
It is what it is. It's where people are detained safely. That can be probably quite a scary environment. It's not the best place for somebody who's mentally ill, and there are other places of safety which would be much better suited for somebody with a mental illness or symptoms of a mental illness.
Street triage is essentially mental health services and the police service working in partnership.
It's basically where we have an approved mental health practitioner, a qualified mental health professional within the control room to be able to give real-time advice to police officers out on the street.
The aims of street triage are to improve access to services for people who have mental health issues.
It enables us to use police resources and time more efficiently.
With a view to try and avert a Section 136 detention.
Devon as a policing area is huge. Because we have a large geographic area, the funding that we had available was never going to enable us to have a mental health professional with a police officer in every geographic area of Devon. When someone is in crisis, we usually become aware of that as a service via a phone call. If we're going to put an intervention in place, the best place will be in the control room when we first become aware of that.
There's two parts of the service. There's the part of the service that can provide information and advice and support to the whole of police response officers in Devon.
We have a mental health nurse that's in the control room. At the moment we operate Thursday, Friday, Saturday, Sunday evenings, 8 till 6.
If there's anything that comes that there is a question mark over whether mental health particularly is a part of the presentation, a call will be forwarded to us, a log, police log. We'll look at that log, and what we can do is add more information and hopefully help them formulate the most appropriate plan.
If it's then necessary, we can put that nurse in direct contact with the officer out on the street.
Mark I'm the Street Triage liaison worker. I'm looking this individual up now.
We can also, from here, again attend incidents in the urban areas. And then we might go and make a face-to-face assessment on the street or in an appropriate area. If we go and see somebody, then we can make an assessment and we can make recommendations. We can formulate a plan, discuss that plan, and if that looks like it's the most appropriate way forward, then we can put that into place, with the support of the police and with the support of other colleagues that we might have in the community. We're generally talking about sort of acute kind of emergency situations. It's more reactive care planning, and because we have to react to whatever the situation that presents. And sometimes sometimes there's background knowledge which will be very helpful in because we know what's happened very recently. Other times we'll know very little ourselves, and we might well make an assessment and decide that a Section 136 is actually the most appropriate way of offering that person the right care. But if there's an alternative and we can put that into place, then that's what we'll do.
The key factors in Street Triage being successful are police and mental health workers working together in the same room, supporting each other, learning from each other.
Police officers are not medically trained. What Street Triage provides is a route around that longer term issue of training, because it provides people who are highly trained at their fingertips.
The key point is the place of safety. If you can get the person who's in the crisis to relax, somewhere where they can have a cup of coffee, where they can chat to a nurse, discuss what's on their mind, get perhaps to the root of the crisis, I think that would be very positive.
We're able to share critical information to the benefit of the service users.
It's a general filtering of knowledge, and that's got to be a great benefit.
To date, since the service became operational, which was back in March, we've had about 500 people referred through the service.
Of those 499 referrals, around 180 of those have been missing person inquiries. 18 of those have been high-risk missing people. The liaison with Street Triage has assisted us in finding those high-risk missing people extremely quickly, a lot quicker than it would have taken with just the police alone. The number of Section 136 detentions carried out by officers in Devon and Plymouth during that period have reduced by 29%, whilst we've had Street Triage nurses in place in the control room able to offer that real-time advice, as opposed to the national average, which I think is 24%.
I think the next steps are constantly reviewing our practices and constantly ensuring that those practices deliver the best possible service to the public.
From our point of view within the control room, we'd like to increase the hours and the availability of the nurse to the officers on the street. It's publicising the service so that everybody knows about it. It's word's getting out there now, and developing our service with other agencies. I know the ambulance service are interested in coming on board.
As far as Street Triage goes, I'm working with 2 police forces. I'm evaluating the Street Triage system as it's being rolled out. I'm hoping that my input will allow strategic planners to recognise what's working within the service and perhaps what isn't working as well. I think Street Triage is a tremendous improvement on the previous system.
If we've saved one life, it's been a successful pilot, and I'm confident we've saved numerous lives.